Welcome back to This Week in Immigration. I'm Jordan LaPier. On the program today, we're breaking down the intersection of immigration, cross-border policy, and the coronavirus. Stick around. Joining me today are Theresa Cardinal-Brown. She's BPC's Director of Immigration and Cross-Border Policy, and she's on Twitter at BPC_TBrown. And Cris Ramón, Senior Immigration Policy Analyst, on Twitter at CRamonBPC. And Dr. Anand Parekh, BPC's Chief Medical Advisor. He's on Twitter at AParekhBPC. Welcome to all of you.
Thanks, Jordan.
Hey, Jordan.
Hey, Jordan.
So before we get into it, a quick note for our listeners. We're recording this conversation on Wednesday, March 18th. The world is obviously moving faster than ever, and some of the issues we discuss may change between now and when you get to hear this. So we're going to work with what we know now and try to anticipate some of the ways things may change over the next week and beyond. All right. At least in the context of this show, the first time we uttered the word coronavirus was in relation to a White House-announced ban on travel from China some weeks ago. Since then, suffice to say, things have moved quickly, and the number of cases is climbing in the United States and around the world. Countries from Italy and Spain to Guatemala and Canada have taken the extraordinary step of more or less shutting down their entire countries to contain the virus. And the United States has announced a spate of travel bans of its own. Borders are being closed to non-essential travel all over the world. So let's start here. What travel bans has the White House announced so far?
So, as you mentioned, the first travel ban was issued against travel from China. The president, in his national address to the country about a week ago, announced a travel ban for the countries of the Schengen area of Europe. A few days later, he announced an expansion of that to the UK and Ireland. And as of this recording, it's reported that the United States and Canada will be restricting travel between the countries fairly soon.
There's also been an announcement as of the time of this recording. The details are still forthcoming of a potential ban on arrivals between ports of entry on the U.S.-Mexico border, as well as the U.S.-Canadian border as well. The details, like I said, are still being figured out because we still haven't seen the order. It hasn't been announced yet. But what we do know from reporting is that it will be almost exclusively targeted at asylum seekers. So this is kind of keeping in line with what the administration is doing, but the actual regulation seems to be all-encompassing of all arrivals between ports of entry.
Anand, how helpful are these measures now being taken by many countries when it comes to actually stopping the spread of the coronavirus? I've seen some argue that it's too little too late, but are these travel bans and border restrictions doing any harm?
Well, I think in terms of the help, I would say, Jordan, that at this point, the impact is probably limited. This is a global pandemic. There is community-wide transmission across the United States. The way we're going to bend the curve in the United States is through testing, social distancing, and surging critical medical material to healthcare. Could it in fact reduce some cases from other countries? Absolutely. So it could help at the margins. But I think people have to understand at this point, we're not doing this to keep the virus out. The virus is already here. We're doing this for mitigation purposes. And then I think you have to think of the costs. It takes time, energy, expense, as well as resources every time you focus on borders and bans and closures. And so the trade-off there are these resources that could be better used to implement other strategies. I think those are some of the questions that people have and the decisions that policymakers have to make.
I might just add that the original travel restrictions were more of the administration called them bans, certainly China and the EU. What we're hearing now, at least with regard with Canada, is travel restrictions. That is barring non-essential travel. Now, we don't know exactly how essential travel is going to be is going to be defined. And supposedly, at least when it comes to the land borders, it's not going to affect cargo, which means that truck drivers and train operators would be allowed through as essential personnel. So a lot of this right now, as Anand said, is going to be operational implementation. When you're talking about screening travelers from abroad, from overseas, coming on airplanes, there is a large resource intensive operational impact at the airports, as you have CBP officials who have to ask additional questions of passengers, who are referring to medical professionals for additional medical screening. And then there's follow-on care that's required if people have to self-quarantine, like returnees from Europe, for 14 days. So there's a big operational impact. If we're talking about just reducing essential travel, for example, across the U.S.-Canada land border, then it really comes down to what are we defining as essential, and what are we saying to people whose travel we deem not essential? If it's simply about asking people to restrict their own movements, that's fine. But how we enforce that at the border is what matters.
So I'm curious, Theresa, how does this step mirror the way the Trump administration has approached the Central American migration crisis and the U.S.-Mexico border more broadly?
Well, for this administration, pretty much from day one, it's been all about the borders. And certainly the initial response of this administration was the same that they had to trying to forestall the arrivals of people at the U.S.-Mexico border, which is just shut it down, find ways to stop the arrival of the virus by shutting down travel, or stop people from arriving at the U.S.-Mexico border to apply for asylum through whatever means necessary. We are obviously in a different scenario now. We're talking about a virus that, as Dr. Parekh has said on this podcast, doesn't know borders. But the same kind of strategies seem to be at play a little bit. And in particular, at least reporting today about what's happening at the U.S.-Mexico border seems to be, again, focusing on asylum seekers. It's not clear that there's a medical reason to do that. So whether or not we're intersecting our immigration agendas with our medical response here is an open question.
Yeah, and I think the other key component is the way that the administration, in both cases, kind of sat on their laurels a little bit. They just sort of assumed that we can sort of rely on travel restrictions from China, or that we can rely on the Remain in Mexico program at the U.S.-Mexico border, or the asylum cooperative agreements with the Northern Triangle countries to sort of basically push away either immigrants from the U.S.-Mexico border, or in this instance, individuals who might be infected with the virus. But the problem is that the administration, in both cases, didn't do anything to prepare or address the infrastructure weaknesses in order to address either the spread of the coronavirus with what we're seeing right now with this public health issue, or in the case of processing asylum seekers arriving at the U.S.-Mexico border. If any of these policies fall apart and you have a surge of migrants arriving at the U.S.-Mexico border, we haven't improved our processes to manage those arrivals and deal with them in effective, humane, and management-directed focus. So that's the thing, is that there's this assumption that if we can keep away things, whether they're people or diseases outside the United States, that's all we need to do. But as we know, that's not how reality works. You need to have an infrastructure and a prepared response to deal with this.
How big a challenge is it to shut down a land border the length of the one between the United States and Canada, or between the United States and Mexico, say, if it comes to that? It seems to me like logistically this is going to be a huge undertaking.
So I want to be clear, at least right now, as of this recording, we're not talking about a full shutdown of the border. We're talking about some restricted travel. We're talking about managing the border differently. And it's also fair to say that, even after 9/11, we didn't actually shut down the border. We imposed additional screening and vetting of all travelers, which significantly slowed down the border almost to a crawl, but we never officially said none shall enter. So I think that, we need to be clear what we're talking about here. Even though the president has talked about shutting down the border, one of the main reasons is that we are so dependent on particularly Canada and Mexico for an awful lot of our trade. And, we import and we export. They're our number one and number two trading partners. We're talking about integrated food supply chains. We're talking about integrated manufacturing. So a lot of those goods that are, fleeing off grocery shelves right now in the response to this virus, a lot of it's coming from Mexico or from Canada and vice versa. So we need to be cautious when we talk about shutting down the borders, that we're not inadvertently hurting ourselves in response in ways that are going to hurt our ability to respond to this. So I think restricting travel is something that can be done. It depends on exactly how it's defined and, again, operationally how it's going to be implemented at the borders. I would expect that no matter what, we'll see delays. Even if the volume decreases a lot, it will take longer for people to cross because there will be additional screening and processing necessary to determine if it's essential. But we haven't yet reached that threshold of saying we're actually going to shut down the border.
And I think this president has been very focused on what's happening with the stock market and the potential economic fallout of this pandemic. So the question is whether he's going to be looking at these policies and trying to at least maybe try to maintain some level of trade so the stock markets don't continue to tumble in the way that they have. So that's an open question. We don't know. Obviously, a lot of details need to be coming out, but I think that's a dimension that needs to be mentioned as well.
And Anand, what is the experience like for an American citizen who's returning to the United States now? What kind of screening are they going through before they're allowed to re-enter?
I believe that they're being checked to see if they have a fever. Their travel history is being checked. They're being asked whether they have been in close contact with somebody diagnosed with COVID-19, particularly in the last 14 days. Certainly, they're being asked about symptoms. And then if somebody strongly screens positive, then they're most likely triaged to some sort of quarantine process, whether it's voluntary or mandatory. But that is the process. I think one of the concerns over the weekend, as we saw the most recent sort of presidential order, at least from European countries, is just the overcrowding in some of the airports, and hopefully this is getting better day to day. But the one thing we're telling all Americans to do is not congregate in big groups, and then you see hundreds and hundreds and hundreds of people for hours on end waiting in lines there. So hopefully that's getting better and not creating new challenges as we're trying to solve older challenges.
All right, when we come back, how the pandemic is impacting the immigration system writ large. We're back. As the coronavirus pandemic fundamentally changes many aspects of American life, it's also changing the immigration system. Everything from immigration courts to enforcement actions to the asylum agreements with Central American countries. So maybe we can just walk through some of the ways DHS and other agencies are having to adapt right now.
Let me start with U.S. Citizenship and Immigration Services. So early on, when the state of Washington experienced their major outbreak, USCIS offices in Washington closed down. Now, USCIS offices around the country conduct green card interviews and naturalization interviews, as well as other sorts of paperwork for green card holders who are renewing their green cards and other things. And so when they shut down, all of their appointments and interviews have to be rescheduled. So see, people who are in process to receive these benefits, all of their cases get backlogged and delayed. So sometimes if one office is closed due to, for example, a localized issue such as a natural disaster or a storm or power outage, those cases can be easily rescheduled or sometimes even relocated to another nearby federal office. But in this case, the question then arose whether USCIS should close down all of its offices. They finally made that call this week, and U.S. consulate offices overseas, for the most part, have started postponing all visa interviews. So what this essentially means is that for the time being, we are closing down new visas and green cards, people coming into the United States. Now, we don't know how long this is going to last for. Obviously, all of us are in that uncertain time period. But the longer it goes, the more likely we will see a significant drop off at the end of the year in the number of people who are getting green cards and visas and naturalized this year, simply because the system will have a difficult time catching up later to this increased backlog of cases.
Yeah, I think that's kind of the key point, because if you think of it as if your local DMV was shut down, right, and people had driver's licenses.
Which a lot of them are.
Yeah, well, which they are, and then you have driver's licenses exams and or tests that need to be administered. I think that kind of gives people the sense of sort of the scope of this, of what it means to have these USCIS offices shut down. But the thing is that the stakes are a little bit higher, because people are trying to get benefits to stay in the United States permanently with green cards, for instance, or trying to adjudicate different types of benefits. And in some ways, these delays just make their stay in the United States, as they want to make their lives permanently here, a little bit more precarious. So it's not simply that USCIS can't do its work. It puts a lot of immigrants who are going through the legal immigration system in a pretty precarious situation, and just leaving them, I think, rightly so, feeling a little bit concerned and anxious about what's going to happen next.
Yeah, there are some people for whom the delay could mean falling out of status, for example, or losing work authorization. So that can have significant impacts on their ability to continue their lives. So it's not just about a delay. For some people, as Cris said, it can be a significant impediment to moving ahead with their lives and seeing what's next for them.
Theresa, I've also seen reports that foreign students are particularly concerned about what the shift to online classes means for them, both now and in the future if this continues into the fall semester. What's the concern here, and how is DHS trying to address it?
Yeah, so, as we're seeing universities closing down their campuses and moving everything to online learning, it's important to understand that foreign students in the United States, and there are a lot of them around the country, are required by regulation to pursue a continuing full course of study toward their degree objective in order to maintain their immigration status in the United States. So these disruptions could have a potential to impact their status. Under department regulations, online classes, at least a full-time online load, is not eligible for foreign students to be present in the United States. As a matter of fact, you may remember that there was a case of a fake university in Michigan that was offering all online classes that caused some students to be deported over and some other people to be prosecuted. But now we're having, obviously, legitimate schools all across the country going to only online learning. DHS and in particular ICE, which runs the Student Exchange Visitor Program, put out guidance that said, in light of what's happening, schools are making decisions to move online. If they notify ICE within 10 days of the changes, that there will be quote unquote flexibility with regard to foreign students for this temporary measure. I think the question there is, what is flexibility? And the second question is, what is temporary? So flexibility may mean that they won't consider somebody to have lost status as long as they're continuing their regular course load, even if it's an online way, and if it's due to, a move that the university did. But temporary is really uncertain now, because we really don't know how long this is going to be. I mean, for some schools, they're now saying they're not going to let anybody back on campus for the end of the school year. We don't know if it's going to go into the fall or through the summer. And at some point, what may become a temporary measure, how long does that affect people in their status? The other thing is that for some immigrants whose campuses have been closed down, going home means going abroad. And when you go abroad, you're no longer in student status, because your status is only when you're in the United States. And the question then becomes, what is the requirement for them to return if and when campuses open? In part because if you have broken your presence in the United States by more than several months, you can be deemed to no longer be matriculated at your at your school, or be continuing your course of study. So all of these are really complex things that I think DHS and schools are trying to work out on behalf of their foreign students. My guess is that over time, many of these students who do end up going back home overseas will have to get new visas and new documentation to come back and return to their course of study, assuming they remain matriculated. The schools are going to have to do a lot of documentation. But more so, I think that you have a lot of students asking a lot of questions, and schools really need to be paying attention to this group and providing as much information as they possibly can and trying to get as much information from DHS as they can. I would also say that foreign students who have finished their course of study and some who are also currently in their course of study may be engaged in employment under what's called practical training. It could be curricular practical training where it's part of their actual degree requirement, or optional practical training that is after or beside. In order to maintain status, they have to maintain that employment. So if their employer is going remote or shutting down and they cannot continue to work remotely, their maintenance of status is also in jeopardy. And that can also be true for foreign workers in an H-1B or other status. So I think we need to recognize that these changes that are happening throughout our economy can have an impact on the status of foreign nationals who are in the United States in these lawful temporary statuses.
Yeah, the point to repeat there, like I said earlier, is just that lack of certainty. I'm not really sure if we've seen a moment like this where you have that lack of certainty for a large population of individuals in the legal immigration system to this extent. Obviously we always talk about this for the undocumented population because they lack status and many of them can be deported at any given moment. But it is unnerving to sort of see how this pandemic is really placing a lot of individuals who are here on a lawful status. Some of it's obviously temporary, but to really put them in a position where, once again, there's a lot of precariousness to what they deal with. So really can't underestimate how much this is impacting the immigrants themselves as well.
And I would just say that leads to another part of the immigration system which is impacted here, which is our immigration enforcement system. We have, in times of natural disasters, Immigration and Customs Enforcement usually issues guidance saying, hey, look, we're not going to do enforcement operations in this region, so immigrants in the area don't need to be afraid about seeking help from FEMA or assistance. We want to make sure that everybody feels safe. Property and health and safety are of primary concern. The president has declared this COVID a national emergency, and we have not yet seen any such notifications from ICE as to whether or not it's going to change its enforcement priorities. As a matter of fact, there was a large immigration operation just last week that apprehended close to 200 some individuals. There are lots of concerns about the conditions in immigrant detention. If they are apprehending people and putting them in detention, whether or not that is a place where we could see the COVID virus spreading. And so I think this is another one of those questions that remains open is exactly how will the immigration system be responding to this? It seems very much like in a situation where, as Dr. Parekh said, we want everybody to get health care and we want everybody to be treated because everybody is responsible for essentially limiting the scope of the spread of this virus. That includes immigrants regardless of status. So, I think this is something that definitely the immigration system needs to look to. Even, the immigration courts are another place where, immigration courts, master calendar hearings can have hundreds of people in a courtroom at once. And until recently, they had not shut down the immigration court system. They had closed master calendar hearings, but they were still doing merits hearings across the country. There was an unprecedented agreement between the Immigration Judges Union and the Immigration and Customs Enforcement Lawyers Union requesting that DOJ shut down the immigration courts right now to prevent the spread of COVID that went unanswered for a very long time. And we're just now starting to see some responses from DOJ to close that part down. Now, again, that's necessary from a medical point of view, but the implications for those people who are in those court cases are significant. If they're applying for asylum, for example, that may be delayed. if their case is continued and ICE is still continuing operations, will ICE move to deport some people in the meantime? That has happened. There's just a whole lot of questions about how this is going to have ripple effects throughout the system.
So it's reiterating that point that, once again, this is creating a significant backlog in another immigration system, our immigration court system that we've talked about a lot on this podcast. How this backlog is problematic on a whole host of fronts, and the fact that now the pandemic is now compounding these issues has been really problematic. One thing I think that to know, thinking about immigration enforcement, is the Trump administration's border policies on asylum. What's been interesting about this is that over the last week or so, you started seeing announcements from the Guatemalan government basically starting to know individuals that could not come to Guatemalan territory. There was an announcement saying that, certain travelers from the United States and Canada couldn't come there. But then things got interesting and they just started saying, no, you can't, we won't receive Guatemalan nationals being deported from the United States to Guatemala, and started saying, we won't do this because of concerns about COVID-19. For me, when I saw that, I kind of knew that the asylum cooperative agreement that the United States signed with Guatemala that allows the United States to send an asylum seeker from the U.S.-Mexico border to Guatemala to apply for asylum protections there. I knew that was kind of, it was running on its days were numbered, at least for the moment. And of course, the Guatemalan government eventually made the announcement that they would not receive returnees from the United States under the auspices of this agreement. That's pretty significant because the asylum cooperative agreements have been, I think, one of the cornerstones of the administration's efforts to deter the arrival of asylum seekers from Central America and other parts of the world. And the program was expanding quite significantly. I believe Camilo Montoya from CBS News said that at the time of the suspension of the agreement, I think there were like 989 individuals that had been sent back. So it was growing significantly, and now that the fact that this is now essentially suspended, the open question is, of course, is what the Trump administration is going to do in lieu of this. But I think the core issue is that the pandemic certainly has limited its asylum policies, and certainly has impacted the way that it's the way these agreements are being implemented, the fact that, the partner governments for these agreements are following their own self-interest in this and saying we need to protect the health and the safety of our citizens. So in a way, it's interesting to sort of see an administration that leaned in so much on these agreements now all of a sudden find itself potentially in a position where it can't really utilize them. It should be noted El Salvador and Honduras, those other agreements haven't been implemented yet, but El Salvador and in Honduras are starting to take some pretty stringent measures on the arrivals of foreign nationals to those countries. El Salvador, I believe, actually shut down all travel from foreigners to the country. So I think it's an open question of how long when these agreements are going to be implemented this year, if they're implemented at all, because of these concerns.
Yeah, and just circling back to something we said in the last segment, I mean, the proposals along the U.S.-Mexico border that deal with asylum seekers could very well be an attempt by the administration to try to mitigate what their concern is with the abrogation of the asylum cooperation agreements, that more migrants might try to come. We don't know how all of this is going to play out. We don't know exactly how this is going to be. But I think the point that we're trying to convey, and that hopefully the listeners will get, is that there could be widespread, long-range impacts to our entire immigration system from the response to this coronavirus pandemic. And we could be dealing with that for a long time. The other thing I would say is that, as Cris mentioned, the fact that we really haven't focused and dealt with the structural problems in our immigration system before now, it's even more evident how problematic it is when you have to adjust during a crisis. And maybe it will promote or push Congress to really try to address some of these issues in the future when we're past the immediate danger here. because the fact that we haven't done it before is certainly showing in how we're treating the responses now.
Okay, after the break, suspending the public charge rule. We're back. As the coronavirus pandemic has spread in the United States, the debate over the Trump administration's public charge rule for would-be green card holders has intensified. That rule, as you'll recall, would make it harder for migrants to get green cards if they have ever used or are likely to use any host of government benefits. In the current context, the worry in some quarters is that the rule may discourage non-citizens from seeking testing and treatment for COVID-19 out of fears it could jeopardize their ability to get a green card. Now, 17 state attorney generals and Democratic members of Congress have asked the administration to suspend the rule, and the administration has issued some guidelines creating exemptions from the rule related to COVID-19. So we've talked a lot about the public charge rule over the last year on this show, but we haven't looked at how the rule considers a non-citizen's use of medical benefits. What exactly does it say?
Well, it does indicate that certain types of medical benefits, for example, using subsidies under the Affordable Care Act, if people are eligible, could result in a public charge decision. It's important to understand that most non-immigrants, people who are applying for a green card, would not be eligible for a lot of medical subsidies or medical like Medicare or Medicaid. But to the extent that they are able to access, for example, state-based health care. So, for example, in California, Medi-Cal is available to non-immigrants who may be in an unauthorized status. And so use of those benefits could be considered in a public charge determination. Other types of medical-related benefits, for example, children's health insurance under state CHIP programs is not considered an eligibility. But all of that is, frankly, somewhat less important than the fact that there's so much confusion out there about what the rule would and wouldn't cover. It's been very, very poorly communicated. It's been out there for 2 years, creating a sense of concern in amongst immigrant communities. There are a lot of immigrant services providers in states and localities who have noticed a significant drop-off in enrollment for various programs that ended up not being part of the final public charge rule, just out of concern. Even existing green card holders are afraid that somehow it's going to affect their citizenship, which it won't. So I think the fact that there's been so much confusion about this regulation, the fact that there is a lot of misunderstanding and fear about its impact has already caused a lot of immigrant communities to pull back and be concerned about reaching out for necessary services, including what may be necessary health care.
Yeah, I will just add that, as we say, microbes know no borders, microbes don't know immigration status either. And in this case, when you're talking about an infectious disease that can be transmitted from one person to another, we need to make sure that everyone within our borders, or at least under our control, gets the testing and the care that they need. And I think that the public charge rule, to the extent that it is causing individuals to fear either getting tested or care, that will just simply hamper our ability to get this respond to the outbreak in an effective this pandemic in an effective manner. And so at this point, it is counterproductive. I would love to see it suspended given the crisis that we're facing right now, because we don't want anyone really foregoing medical care for fear of deportation or for fear of this resulting in some negative impact to their immigration status.
So what steps has the administration taken to respond to some of these criticisms or these concerns?
So Ken Cuccinelli, the acting director of U.S. Citizenship and Immigration Services, issued a statement saying that seeking treatment or testing for COVID-19 would not be used in any future public charge determination. That statement came after a week or so of badgering by some Democratic members of Congress who said that he had committed to that in private quarters. We have already talked on this podcast about whether or not Mr. Cuccinelli is legally in his position, so his statement may or may not have the the authority that they may wish, but it is something. But what I would say is that just saying that use of benefits to seek treatment or testing for COVID-19 may not be sufficient, because as we know, the symptoms of this, and Dr. Parekh can confirm this, are very similar to the seasonal flus that are going around. So if someone goes and gets the test and it tests negative for COVID, but they have the flu and they already get that medical treatment, then it's counted against them. So I don't think there's necessarily an easy, narrow fix for this. I think we need to understand the sort of broad-based fear that's out there and allay that fear as much as possible.
I think the other thing to consider, obviously, is the economic dimension of the pandemic. That we are hearing lots of discussions of potential benefits that might be doled out to Americans. We've heard about $1,000 being sent to every American and $500 for their children. Those are just sort of those proposals. And so if you consider that, once again, USCIS and Ken Cuccinelli have not issued any statements on what benefits, if any, non-citizens might be able to access without coming across these issues when dealing with the public charge rule for seeking a green card. So I think that's another dimension that needs to be considered as well, is that it's not only a public health, but it's an economic issue. And once again, immigrants find themselves in a particularly tight spot if they're stretched out economically and financially.
Theresa, Cris, Anand, that's a good place to leave it for today. Thanks as always. We'll be back in 2 weeks, but before we go, please remember, rate, review, and share this podcast on your favorite platform. You can find us on Apple Podcasts, Google Play, Stitcher, Spotify, and more. Just search This Week in Immigration. And join us on social media. We're on Twitter at BPC_bipartisan, and on Facebook, search Bipartisan Policy Center. This Week in Immigration was created by Theresa Cardinal Brown and myself. The executive producer of This Week in Immigration is Theresa Cardinal Brown. This week's episode was written by Cris Ramón and myself. Our producers are Cris Ramón and Yafat Tawahada, and the executive producer of BPC Podcasts is Ashley Swearingen. Thanks for listening. See you next time on This Week in Immigration.